We are back on this Saturday morning with your health, and as we reach yet another record high for daily cases of coronavirus, we thought it was important to try to take a moment for a coronavirus safety reminder.
That's right. So we called in the experts, NBC senior medical correspondent Dr. John Torres and NBC investigative and consumer correspondent Vicky Nguyen. Good morning to both of you.
Vicky, let's start with you if we can very quickly. Help give us the basics here, if you would, Vicky. Okay, the do's and don'ts as we head into winter.
The number one most important thing we can all do, and it's an easy one, Peter, wear a mask when you're out in public. You want to avoid large gatherings, especially if you're in a hot spot. When you're socializing, stick to your pod. That's that small quarantine you've put together, the people you've been hanging out with that are observing public health guidelines. I think Dr. Torres would agree with me, and you all too. We don't want another lockdown. We don't need another lockdown. If we take personal responsibility and follow those 3 W's, wear a mask, watch our distance, and wash our hands, we can avoid another lockdown and keep COVID rates low.
All right, and Dr. John, this one is for you. What are some things people should have on hand in their homes in case someone they live with gets sick with COVID?
And remember, the vast majority of coronavirus cases, if you do have that, you can take care of at home, just like you can most of the flu and cold symptoms you have. So think about what you've had in the past, just having tissues on hand that you can wipe your nose with. You want to make sure that you have the cold and flu type medicines that you've had in the past, but also you want a space where you can isolate people in case they get sick. You want the medications and food that you might need for 2 weeks, because if you do have to isolate yourself, you want to be able to do that. Having a thermometer on hand can certainly help determine if you have fevers, because sometimes it's a little difficult. And that pulse oximeter, well, that can help a little bit with understanding if coronavirus is getting bad enough where you need to be seen. And of course, the water, the Gatorade, those types of issues. But like Vicky was mentioning, make sure you have masks and hand sanitizer, because if you do have sniffles, you don't know if it's coronavirus, flu, or cold. You want to make sure.
Vicky, you know, in the early stages, we saw so much panic buying, right? Just ask the toilet paper aisle. What do we do going forward now to stock up in a safe and practical way that doesn't clear out store shelves?
We want to be flexible. We want to shop early. I can't believe we have less than 2 weeks until Thanksgiving. So something to do is, if you see what you need, buy it, but don't hoard. We've talked to many retailers as well as food makers, the CEO of General Mills, telling us that they've spent the last 8 months learning from what happened in March, and that they are prepared for the potential surges right now and people who may be trying to stockpile. Stores are also doing their part by putting limits on certain items. I mean, who could forget when it was so hard? You felt like you won the lottery if you could find some toilet paper. I will say these are still hard to find, disinfectant wipes, but here's a pro tip. Don't forget about shower cleaners. Those often contain the same cleaning agents that are EPA approved to deal with this virus. So you just want to look on the back. There's an EPA registration number right there, and you can check with the website to see if you're not finding the cleaning agents you're used to, the bleach, the hydrogen peroxide. You can also try shower cleaners as well. We really want people to know there is enough to go around. Sometimes you're not going to get your first choice, the brand that you want, but we're not going to see the kinds of situations we did back in March, at least according to the food makers and the retailers who say they are ready this time.
I think we all have a little bit of PTSD. When you see some toilet paper, you just buy it
Grab
right now. It's not worth risking it.
Yeah, I still have a lot stocked up.
Please.
Dr. Torres, Vicky, both of you, we appreciate your expertise and your time. Thanks so much.